You can start. It's online.
I should answer myself.
Yeah. Hi everyone. Welcome to Baby Science IVF Clinics. I'm Dr. Ananta Lakshmi, IVF specialist at Baby Science IVF Clinics. Thank you for joining this interactive live session. Today we're going to talk about primary causes of infertility in Indian women. So you can ask your questions in the comment sections below. I'll try to answer them as far as my ability. So I'm just waiting for the questions. Let me start answering a few questions that are already given to me. So the first question is, does PCOD need long medication? So PCOD is a metabolic disorder. It affects the metabolism of the body in general. So it does not need a list of long medications. Usually the first line of management in PCOD would be lifestyle modification, changing your diet, eating healthy diet, doing moderate level of exercise every day, and being physically active. So those will be the major parts of the treatment. And the list of medications which your gynecologist might add on to this would be ovulation inducing agents. When you're suffering from infertility due to PCOS, you would probably having anovulation, that is difficulty in ovulating. So your doctor might add clomiphene or letrozole, which are medicines which will help you ovulate. And at times when there is difficulty in ovulation, even with these, your doctor might add an agent called metformin, which helps in ovulation as well. And some supplements like mycarynositol and folic acid in usual can be added. These are the usual medications. If you are not responding to these oral ovulating agents, your doctor might add gonadotropins, which are injections which will help you ovulate. So, can diabetes cause infertility? That is the next question. So, diabetes is, it can cause infertility in both male and female. In female, diabetes causes infertility by altering the hormonal milieu in the body. So it can impair the ovulation, or it can cause quality in the oocyte. It can impact quality of the oocyte. Also, it can disturb the fertilization and lower the chances of implantation as well. So controlling your sugars, having an optimal level of sugars in your body is very essential when you plan for conception, because the organogenesis is also affected by high levels of sugars in the woman's body. And in male, diabetes can cause problems with erection, ejaculation, and it can cause semen infection as well. So control of diabetes is also important in the males. So I have, somebody has asked, I have thyroid hormone abnormality. Will it affect the chance of getting pregnant? So definitely thyroid hormone is a very essential endocrine hormone when it comes to fertility. So how does thyroid problems affect the fertility? Both in hypo and hyperthyroidism, weight gain can occur, so problems with ovulation can occur. So this can cause problems with the conception. It can also cause defective implantation and increased miscarriage rates, or preterm births can occur even if you're getting pregnant. So moving on to the next question. Is PCOS completely curable by medicine or must go for surgery? So PCOS, like I mentioned, is a metabolic disorder. There is no question of a complete cure of PCOS. It's basically you need to change your lifestyle. That is the basic necessity or the basic management, the first line of management when it comes to PCOS. So how is it completely curable by medicine? No. You need to change your lifestyle, do some weight loss, change the diet to healthy diet. And is there a must for go for surgery? The role of surgery in PCOS is very, very limited. We do something called laparoscopic ovarian drilling to reduce the ovarian volume, which is not widely practiced now. We're almost given up. Because it might reduce the ovarian reserve also. So, like I said, the first line of management would be weight loss and changing the lifestyle. So, the next question is, at what age PCOS can occur? Can it happen with young adult also? So, PCOS occurs mainly in the reproductive age group. It occurs between 20s to 50s. The age of the woman. Can it happen with young adult? Yes, of course. We see a lot of PCOD in adolescent females as well. So PCOS affects the young females and women mainly due to weight gain and sedentary lifestyle and diet habits as well. So the next question is it essential to cure PCOS before going for IVF? Yes, like I said, we need to change a few things before going into IVF, but completely curing PCOS and then moving in for IVF might not be possible all the times. So we first try ovulation induction with oral agents, and then we try IUIs, and then finally, even if the woman is not conceiving, we might have to move into IVF. It is not essential to cure PCOS completely before IVF. These are all lines of management. We move step by step. The next question is there a trend of increased chances of PCOS seen among young women? Yes, of course, there is a trend of increased incidence of PCOS we observe in young women. Why? Because it's mainly due to our lifestyle. We are mostly sedentary. Most of us are sedentary. We sit for most of the time during our work, and lack of exercise and weight gain, obesity, and our diet also, eating a lot of junk food and cutting down on the vegetables and fruits. So mainly our diet, lifestyle and sedentary habits are the cause of increased incidence of PCOS in the recent times. So the next question, what are the prominent symptoms of PCOS? Okay, so the symptoms of PCOS would be mostly we can see increased facial acne in young women, or excessive hair growth in the face or in the hands, legs, in the abdomen, and thighs, or in the back, unusual parts. So excessive hair growth, this we basically call as hirsutism. So that could be a symptom, and also weight gain. The girl or woman could be overweight or even obese. Irregular cycles could be a symptom, and the most common symptom for which the patient comes to us is infertility, inability to conceive. And this irregular cycles, the woman would not have regular cycles even after not even once in 35 days. The cycles might be once in 2 months or once in 3 months, or she might not get periods at all, and she gets withdrawal bleeding only with medication. So these are the most prominent symptoms of PCOS. So moving on to the next question, is excessive hair growth on the legs a sign of PCOS? Yes, like we just saw, excessive hair growth is a sign of hirsutism, which is due to excessive male hormones in the body. When there is excessive male hormones, androgens produced in the body due to PCOS, this causes excessive hair growth not only in the legs, also in the hands, in the thighs, in the inner side of the thighs, in the abdomen, back, and also in the face. Moving on to the next question, is there any treatment for irregular periods? Yes, so irregular periods is the main cause of infertility in these women with PCOS or other endocrine problems. So irregular periods means the woman is not ovulating properly. So anovulation is the cause of infertility in these women. So how do we treat them? Most probably they would be obese. So when they are obese, we advise them to go for weight loss by changing their diet. So you have to avoid lot of these junk foods, excessive non-veg, poultry foods like chicken, and all maida, white sugar, and dairy products you can cut down. And you have to take a lot of vegetables, fruits, dry fruits and nuts. Cut down on the carbohydrates and take lots of millets and the green leafy vegetables every day. So this would be the major part of diet change. And according to as far as exercise is concerned, you will have to take around 45 minutes of moderate activity or exercise every day, and avoid sedentary lifestyle. If your work is sedentary, your work style is sedentary, then we need to make sure we at least do 45 minutes of walking once in a day or twice a day. And you can also take up to yoga or meditation, so that your stress levels are also decreasing, which is also commonly found in PCOS. So this would be the main result of management of irregular cycles. And, moving on to the next question, is there a connection of PCOS with lifestyle and food habits? Yes, like we've seen repeatedly, lifestyle and food habits are the main cause of PCOS, the occurrence of increased incidence of PCOS. So changing our lifestyle, changing our food habits would definitely help in the management of PCOS. Next question, can PCOS be a hereditary disease? Is it possible for a teenager to get PCOS from the mother? Yeah, we commonly observe a lot of PCOS running in the families. When the mother has PCOS, we observe PCOS in the daughter also. When the auntie has PCOS, we see PCOS in the girl. So there is not a proven theory to say that PCOS is genetic or this particular gene mutation is involved in PCOS, but definitely there is a familial factor. So there is not yet any consensus reached, but still we do observe it in families. Moving on to the next question, what are the foods to avoid if one is suffering from chronic PCOS? Yeah, in chronic PCOS, or a patient who has always had PCOS from puberty or from adolescence, who is overweight, obese, and never gets her periods on time, the foods that has to be avoided is avoid junk food, any processed food, packaged items, deep fried foods like chips, and a lot of non-veg, chicken, and lot of foods containing maida, white sugar, and oily foods. All these have to be avoided, and try to keep the diet as natural as possible, like you taking a lot of vegetables, at least 2 portions of vegetables and green leafy vegetable in a day, taking nuts, dry fruits and nuts, and taking at least 2 portions of fruits in a day, and switching over to millets instead of eating white rice, and all these, and cutting down on the carbohydrates basically can help in the treatment of PCOS. So moving on to the next set of questions. Can uterine fibroids cause infertility in women? When does a woman need to be worried about fibroids? Yeah, uterine fibroids are small masses which come up in the uterus, which can cause infertility in some women, not always. So, when does a uterine fibroid cause infertility? When the fibroid is submucous, or when it disturbs the endometrium, which is the inner lining of the uterus. It can impair the implantation or the endometrial receptivity. In that way, it can cause infertility. And when it is a huge subserous fibroid which distorts the uterine cavity, and there are multiple fibroids which distort the uterine cavity, again the endometrial receptivity can be affected, so it will impair the implantation. Also, a huge fibroid which goes and obstructs the fallopian tube from outside can prevent the transport of gametes, can prevent the transport of ovum or the sperm through the fallopian tube. So that way it can cause infertility. When does a woman need to be worried about fibroids? Yeah, so a worrisome fibroid would be a submucous fibroid which is very close to the endometrial cavity, or a huge subserous fibroid which distorts the fallopian tubes. Otherwise, a fibroid which is away from the endometrial cavity would not generally affect fertility, so we need not worry about it. The next question is, what are the tests and diagnosis for uterine fibroids? So, how do we diagnose uterine fibroids? So, basically, any fibroid is detectable even in a simple 2D ultrasound which the gynecologist has in her office. So, that is good enough to diagnose. So, what other modes of investigations we might ask for when we diagnose fibroid in a female would be a 3D ultrasound or an MRI. Why do we ask for this when we see a fibroid in a 2D ultrasound is to know whether a submucosal fibroid is actually disturbing the endometrial cavity. If it is disturbing the endometrial cavity, the fibroid may have to be removed. So that is why we might ask for a 3D ultrasound and MRI. There are no definite blood tests are not required for the diagnosis. So moving on to the next question. Why I am not able to get pregnant even after the AMH test results are normal? So AMH, anti-Mullerian hormone test, is a test which tells us about the ovarian reserve. It tells us how much reserve of follicles, of oocytes we have in the ovary. So it generally tells us regarding the reserve. It does not tell us whether we can become pregnant or not. So your AMH test results might be normal. It might be in the normal range, but still for a normal pregnancy to occur, you need much more things. The sperm count in the male has to be normal. As the sperm is being ejaculated into the vagina, the sperm has to travel through the uterus into the fallopian tube. You have to normally ovulate, and the ovum has to be picked up from the fimbria and it has to be transported into the fallopian tube. And in the fallopian tube, the oocyte and the sperm have to meet, and the fertilization has to occur there. The fertilized embryo, which we call the zygote, will be transported into the uterus, and this embryo has to be implanted in the endometrium inside the fundus of the uterus. So all these are factors which occur normally in a pregnancy. These are essential for a pregnancy to occur. So if any of these factors does not happen, even pregnancy does not occur. So a normal AMH level might not tell you if you are not able to get pregnant or not. When is surgery required for infertility treatment in women? So surgery might be needed for very few conditions in infertility. So when we diagnose a submucosal fibroid, when we diagnose a pedunculated submucous fibroid, we might have to remove it because this will impair the endometrial receptivity. And when you have intrauterine adhesions or polyps, this has to be removed. The adisholysis has to be done, a polypectomy has to be done for the correction of infertility, because this also impairs the endometrial receptivity. This affects the endometrium where the embryo implants. And in huge endometriomas, if it might interfere with the ovum pickup in cases of IVF, your doctor might advise removal of the chocolate cyst or the endometrioma. Or in case of extensive pelvic adhesions, distortion of the pelvic cavity, the doctor might advise adisholysis, laparoscopic or hysteroscopic adisholysis for you. And in cases of tubal blocks, if there is a proximal tubal block, a tubal cannulation surgery can be done. And in cases of severe PIDs with the hydrosalpinx affecting the endometrium as well, your doctor might advise what we call as tubal disconnection or clipping surgeries. So these are the conditions in which surgery is required for an infertile woman. So moving on to the next question. Can endometriosis cause infertility? What is the treatment for endometriosis? Yeah, endometriosis does affect the fertility of the woman in many ways. So how does it affect fertility? We generally believe that endometriosis can impair the quality of the oocyte, and it affects the ovarian reserve. As the endometrioma starts becoming huge, as the number of endometrioma starts increasing, it takes up the ovarian reserve as well. And especially in cases when the girl has been operated for endometrioma previously, the ovarian reserve is definitely less. So, and coming to the fallopian tube, an extensive endometriosis can cause tubal adhesions from outside. Also, the endometrial implants inside the tube can cause tubal block, and the tubal adhesions outside can distort the tubal anatomy and prevent the transport of gametes within the fallopian tube. And in the uterus also, it is believed that endometriosis can sometimes impair the endometrial receptivity as well. So these are the ways in which endometriosis affects the fertility. And what is the treatment for endometriosis? By laparoscopy, we do stage endometriosis. If it's stage 1 and 2, generally ovulation induction and IUIs can be done for stage 1 and 2 endometriosis. If it's stage 3 and 4 endometriosis, IVF would be the right line of management. If no other cofactor is present, if everything is normal, for stage 3 alone, IUIs can be tried. Otherwise, stage 3 and 4, IVF would be the first line of management. So, moving on to the next question. Why is hysteroscopy necessary in infertility treatment? Hysteroscopy is usually indicated in infertility management in cases of polyps, for removal of endometrial polyps or submucous fibroids which can be removed hysteroscopically, and intrauterine adhesions, adisholysis can be done, and also hysteroscopic septal resection can be done for intrauterine septum, which causes recurrent pregnancy loss. So these are the conditions in which we generally do hysteroscopy. Otherwise, these are all therapeutic causes. Diagnostic hysteroscopy, in which we simply, when there are no other causes, when the woman is infertile for a very long time, we might do something called diagnostic hysteroscopy in recurrent pregnancy loss or recurrent implantation failures, just to diagnose, to visualize the cervical canal, the inner lining of the uterus, which we call the endometrium, and the tubal ostia, to see if everything is normal, to diagnose any pathology within the uterus. And moving on to the next question. What causes fallopian tube blockage? Can it lead to infertility, and how is it treated? Yeah, fallopian tube blockage is quite common these days. So the main reason for fallopian tube blockage would be pelvic inflammatory disease. So this can cause scarring of the tubes and hydrosalpinx, and also sexually transmitted infections like chlamydia and gonorrhea also can cause tubal blockage, which is very common in India. Also genital tuberculosis, not uncommon to see genital tuberculosis causing tubal blockage in India. And the other causes of tubal blockage would be, endometriosis or huge fibroids. Also, previous abdominal surgeries. The girl might have undergone abdominal surgeries at an early age, or previous history of ectopic surgeries in which one tube is removed. So, all these reasons can cause fallopian tube blockage. Can tubal blockage lead to infertility, and how is it treated? Yes, tubal blockage does lead to infertility. If only one fallopian tube is blocked, we can definitely try naturally, but that is adequate for the woman to try naturally. If there are both tubes are blocked, the ovum and the sperm cannot meet up in the fallopian tube. So fertilization does not occur at all. So it causes infertility. And how is it treated? In case of bilateral tubal block, IVF could be the only line of management. If it is a proximal tubal block, only the cornual end alone is blocked, then we can try a surgery called hysteroscopic tubal recannulation, in which the block can be relieved. If it is a distal block or a major part of tube is blocked, then IVF could be the only resort of treatment in these patients. I think I'm done with the questions. And just check if there are any more. Are there any tests available to know whether one is suffering from PCOS? So PCOS, the diagnosis of PCOS needs, by ultrasound we can diagnose whether a woman is having PCOS or not. Also, her irregular cycles, which means she's getting periods only once in 2 months or 3 months or never at all. So that is a sign of anovulation. And the signs of hyperandrogenism, so like facial hair, acne, weight gain, and something called black marks in the neck and the back, called acanthosis nigricans. So these are essential or adequate to diagnose PCOS. Do we need to do blood tests? Not always mandatory, but still by blood tests, what do we observe is her LH level, the hormone LH can be high, her testosterone levels can be high. Her SHBGs, the serum hormone binding globulin levels can be low, and the androstenedione ion levels can be high. So these are the blood tests we usually observe in PCOS, but these are not absolutely mandatory to diagnose that a woman has PCOS. I think we're done with the questions. I'll just check if there are any more. Yeah, Ashwin Kumar has asked, what is known as serology test? So what do we mean by serology test? Essentially in all infertile couple, when we evaluate, we do something called serology. So this we do both in the husband and wife. This is done to diagnose whether you have any infection. So this will include HIV, HBsAg, sometimes VDRL, and HCV, hepatitis C virus. So these are infections which can be transmitted from you, from the parents to the baby. So this is essential to be diagnosed when you are undergoing infertility treatment. Yeah. Endometrial stem cell therapy treatment is available. Kindly explain. Yeah. Endometrial stem cell therapies are at the verge of development. These are essentially done to improve. In certain women, the endometrial lining will be very thin, which impairs the implantation of the embryo, even in cases of IUIs or IVFs. the installation of endometrial stem cells can help improve the implantation in these women. So this therapy is available at present. So if untreated, will PCOD symptoms worse? No, there is PCOD is generally, like I said, it's a metabolic disorder. There is no worsening of the symptoms, but it definitely gets better with changing your lifestyle and weight loss and improving your physical activity. So there is one question. Which procedure is better, HSG or SSG to remove tubal block? So HSG, a hysterosalpingogram or a sonosalpingogram, is a procedure which is done to diagnose if both the tubes are patent, if both the tubes are blocked or not. So with this procedure, we cannot remove tubal block. These are only diagnostic procedures. But immediately after HSG, tubal cannulation surgery, hysteroscopic tubal cannulation can be done, can be tried to remove proximal tubal blocks. I think we are done with the questions. So thank you for watching the live session. I hope the session was informative and I was able to answer your questions. I think we are coming up with more interactive sessions like this. So please follow Baby Science IVF Clinic's Facebook page. You can book, if at all you have more queries or you want to book an appointment, you can call our toll-free number. Thank you.